All right. Welcome to the Meat Mafia podcast. I'm joined here today with two great people. We have Salazzo and our guest, Dr. Phil. Dr. Phil Ovadia, how you doing?
I'm doing great. Good to be here with you guys.
Great to have you. Salazzo, how's life in San Diego for you?
Life is great. This is cool, Dr. Phil. We've all kind of separately swapped. We both went on Dr. Phil's podcast last week, and I was coming on the Meat Mafia podcast. Probably time for the bone broth initiation, like Dr. Brian got. So we'll see how that goes.
I hope to make it out to both San Diego and Austin soon so that we can do some in person initiations.
Excellent. Yeah, some steaks are definitely in order. Um, well, good. It's great to have you on the podcast. We've been talking for a while. We had you on a Twitter space, really got in touch with you early on in our journey. So I think that we've had a lot of great conversations. So just being able to put this on the podcast would be great. Um, just for our audience's sake, you've had your own low carb journey yourself. You're a heart surgeon who's seen some of the worst stories of metabolic dysfunction come to life, or really just run into those really hard and difficult spots. I'm thinking specifically of a few stories in your book that come to mind, but if you just want to start with your own journey in the low carb space, and then we can kind of go from there, I think that would be a great place to start.
Yeah, sure thing. So, I am now about 20 years into my career as a cardiac surgeon, as a heart surgeon. And as you said, as a heart surgeon, I get to see the end result of metabolic disease every day and deal with the people who unfortunately uh, develop those problems. And for much of that time, for much of my career as a cardiac surgeon, I was becoming progressively unhealthy and didn't really recognize it. I had been obese my entire life from childhood. And that was despite the fact that, I largely followed the recommendations. My family growing up ate, very much in line with the U.S. dietary guidelines. I have an older brother who is a type 1 diabetic, so we didn't have any sugar in the house. But, we drank the Diet Coke and we had the margarine instead of the butter and skim milk on our heart healthy Cheerios every morning. And as I said, I just got progressively more obese. And I found myself about 6 or 7 years ago. I was now morbidly obese, pre diabetic, but I was at a loss because I had tried many times to lose weight. I ate less, I moved more, I counted my calories. Just like I had been taught in school, and just like I would talk to my patients about.
Mm-hmm.
And like many people experience, I had had some short term successes losing weight, but then would gain it back and more. And fortunately, I came across low carb. Specifically, I heard Gary Taubes deliver a talk at a medical conference that I was attending. And what he talked about made sense, that it's the types of food that we eat more so than the amount of food that we eat, and all of the hormonal influences that go with that. And so I started eliminating sugar and went low carb. I would say, migrated to a more traditional keto diet, and had great success. I ultimately lost over 100 pounds. I reversed my pre-diabetes and was coming along pretty good. And then I heard a crazy orthopedic surgeon by the name of Sean Baker on the Joe Rogan show talk about, the carnivore diet and eating only meat. And I was like, wow, that sounds pretty, crazy. But, I was at this point open and I really thought about it. And at that point, I was exceedingly low carb keto. I was eating probably under 20 grams a day of carbs and just a little bit of veggies and some guacamole and stuff here and there and nuts. And I said, well, let me give it a try. And I did carnivore and I felt even better. And here I am now 3.5 years after that, and doing, just continuing to thrive and literally in the best shape of my life. Wearing smaller clothes than I did in high school, more muscle than I've ever had, and everything's going well. more importantly, perhaps during that journey, I came to realize that the disease that I had been treating my entire career, what I had been taught about the origins of that disease and what we might be able to do to reverse or prevent it was completely wrong. And I came to realize the truth about heart disease, and that it is an end product of metabolic disease, and therefore the best way to prevent and treat it is by focusing on uh, you know metabolic conditions, and specifically the foods that we are eating, and preventing people from developing the metabolic syndrome. And so that has really led me to refocus my career. So today I continue to work as a heart surgeon, but I also now work with people one on one to help them prevent developing heart disease and to help them, to stay off my operating table, as I say.
It's such a unique and incredible story for someone to be a heart surgeon and then go through all of that. I think it really has a lot of sticking power for a lot of people. So it looked like you had a question there. You want to dive in?
No, it's an amazing story. And, both Clemenza and I read your book, like we were saying before we hit the record button. We both finished it, in a few days because it's so easily readable. It's so digestible. There's so many great principles that you embed into that book. And one of the things that you talk about, one of the eye-opening statistics is you mentioned that 88% of Americans are considered to be metabolically unhealthy. And I know that a big core tenet of your ethos is improving metabolic health. And I think a lot of people hear the term metabolic health and they're used to it and they're hearing it, but they don't necessarily know what that means. So for the listener, would you mind just giving your definition of metabolic health and just maybe some core metrics of what they should be thinking about to improve?
Yeah, sure thing. And that is exactly how I think about it. I talk about what metabolic health is, but more importantly, I make people aware of the metrics that we should be using to track metabolic health, and ensuring that it's optimized. So, at its root, metabolic health refers to, what your body is doing with the inputs you're giving it, and
Mm.
specifically with the food that you're eating. And, when things are going well, when the system is working as it should, your body does one of three things with the food that you eat. Um, some of the food gets turned immediately into energy to be used to fuel all of your activities. And those are both your, kind of macro level activities throughout the day, and also all the micro cellular level activities that are going on within your body. Some of the food gets utilized to build and rebuild your tissues. And again, that's a process that's always going on in our bodies. And then finally, we're supposed to store a little bit of the energy in case there are times when food's not available. And we have to realize that for the vast majority of our existence as humans, on the evolutionary standpoint, there were times when food was not available. Now, we have fortunately, in modern times, largely eliminated that problem. For most of us, absence of food or inability of food is not a daily struggle. And unfortunately, what we now have is an overabundance of food that has basically broken that system. So we end up storing too much energy, and that then leads to downstream problems. From a practical standpoint, what I tell people is that there are five metrics of metabolic health that I think everyone needs to be paying attention to. And, if nothing else, you need to track these five measures, and these five measures need to be at the core of your assessment about whether or not you're healthy. The first one is a simple measure. You can do at home, your waist circumference. You just take a tape measure. You measure just above the level of your belly button. Best to do it first thing in the morning. And if you're a man, you want that to be under 40 inches. If you are a woman, you want it to be less than 35 inches. Another good rule of thumb for that is it should be less than half of your height, ideally. But the official metrics, 40 inches for men, 35 for women. Your blood pressure is the second thing, and you want your blood pressure to be less than 130 over 85, and that needs to be without the use of blood pressure and lowering medications. High blood pressure is often one of the first signs of metabolic disease, and if you've been started on a medication to lower your blood pressure, it likely means that you are not metabolically healthy. And then we look at some basic blood work. We look at your fasting blood glucose level, so the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours, and you want that number to be less than 100 milligrams per deciliter. That's the United States units. And again, that should be without the use of medication to lower your blood sugar. And finally, we look at the cholesterol panel, but we don't look at the number that most doctors focus on, this LDL, or the so-called bad cholesterol. That is not a measure of metabolic health. The other two numbers on there, the HDL, the good cholesterol, and as the name implies, you want this to be higher. Specifically, if you are a man, you want it to be over 40 milligrams per deciliter. If you are a woman, you want it to be over 50 milligrams per deciliter. And then finally, the triglyceride level, which you want to be less than 150 milligrams per deciliter. So you look at those 5 measures. If 3 of those are not within the healthy range, you are diagnosed with what we call metabolic syndrome. And that means that you are at very high risk for developing things like diabetes, heart disease, Alzheimer's disease, many forms of cancer. If 1 or 2 of those are abnormal, that's a warning sign, because we know that people who have 1 or 2 abnormal today are likely to progress to metabolic syndrome over the next few years. And you mentioned the statistic that 88% of the adults in the United States do not meet all 5 measures of optimal metabolic health. So in other words, only 12% of the adults in the United States today can meet all 5 of those measures. And as I said, I think this should be the center point. Every time you go to the doctor, they should be looking at these numbers with you. People should be tracking this by themselves. And whatever changes you want to make in terms of your diet, your lifestyle, these should be the metrics that you're gauging whether the intervention is successful or not. Because we know that having metabolic syndrome, that having abnormal metabolic health is what is at the root cause of heart disease, many forms of cancer, Alzheimer's disease, diabetes, and you can just keep going down the list of all of the common things that end up killing us.
That's great information. Is there one number so I'm thinking, if I step on a scale and lost 20 pounds, will that 20 pounds directly reflect into all 5 of those metrics? Or is there, we use the term skinny fat sometimes, right? Like people can be skinny and still have metabolic dysfunction. Is there something that people can look at? Obviously, a scale is the easiest one, but is there one number that can really help people cover all 5 of those bases?
Well, it turns out that if you look at each of those, individually, the waist circumference is actually the best predictor. And again, it's a simple thing that you can do at home. But the scale can sometimes mislead us. Depending on body composition, you can be technically overweight or obese, but you can still be, metabolically healthy
Right.
if you have a good body composition, lots of muscle, and a thin, waistline. That's why I'm not as big a fan of using weight as your metric. It does have correlation, obviously, to all of these things. Most of the time, when you're losing weight, your waist circumference is going to be going down. And, with weight loss, oftentimes comes improvement in your blood sugar and your blood pressure. But weight alone doesn't quite get at what we're looking at, because in that same study that showed that 88% of the adults are not healthy, what they found was when you look specifically at the people who were underweight or normal weight, more than half of those people were not metabolically healthy.
Wow.
So you can't assume that just because you're not overweight, it means that you're metabolically healthy. And as you mentioned, we have, this condition that we call skinny fat, or TOFI is a medical term, thin on the outside, fat on the inside, where people may not be overweight, but they have a lot of visceral fat, a lot of fat within their abdomen around the organs that correlates to poor metabolic health. So that's why I really stress the importance of looking at these 5 metrics, because they are what will tell you whether or not you're metabolically healthy. And surrogates like weight just don't fill in for those 5 metrics. But again, the easiest one to measure at home, and the one that becomes, it turns out, is most predictive by itself, is your waist circumference.
Got it. What, in your own personal journey, what would you attribute most of the change through nutrition for yourself, or through a more active lifestyle? Like, if you had to attribute the change to those two, where would you kind of allocate your efforts?
Yeah. So, what I saw in my personal experience, and what I continue to see with the patients I work with, is that, diet is first and foremost. And if you're not eating correctly, the other lifestyle issues like, exercise, sleep, stress, which all play a role, but you can't ultimately overcome the bad diet. And I think you can do this, you can get metabolically healthy without really doing much on the activity front, without exercising a whole lot. So I would say the diet is probably 90 to 95% of it. And then the other stuff, the sleep, the stress, getting adequate sunlight, those types of things, which are all also important, but you got to get the diet right first.
Yeah, no, that's great. And I would think too, and I meant to ask you this, when you're laying out your 5 principles of metabolic health, I would imagine that the cholesterol panel is probably the most polarizing, right? That's something that we hear about all the time. What would you say to someone that's been taught to associate LDL as the bad cholesterol, and maybe has never heard about things like an HDL to triglyceride ratio?
Yeah, so, ultimately I tell them, you just need to look at the data and look at the science. And for instance, there was the large Women's Health Initiative study that came out 2 years ago, and it directly compared the predictors of the predictors of heart disease, and it looked at things like insulin resistance and LDL cholesterol levels. And specifically, when you look at a blood measure of insulin resistance, they use what's called lipoprotein insulin resistance, and the risk associated with having that being abnormal, being elevated, versus the risk associated with having your LDL cholesterol level elevated. We find that the LPIR, the insulin resistance score, is 6 times more powerful of a predictor of risk than your LDL cholesterol. So what I tell people is that it's not that LDL cholesterol doesn't mean anything. It's just not the most important thing, and it's not at the root cause of heart disease. And, we have these, there is a growing controversy, I will say, around whether or not being metabolically healthy and having an elevated LDL cholesterol is problematic or not. And the reality is we don't have the definitive data that we need. There are people like Dave Feldman and others out there, trying to work to get that data and do the studies. But there are suggestions within the the science that we do have, and I personally don't think that an isolated elevated LDL cholesterol level in the setting of good metabolic health is something to be overly concerned about. But what I do with patients, in that situation is I say, okay, let's look at other things that we can look at. And things like a coronary artery calcium CT scan that can actually tell you whether or not you have heart disease or not. And what I end up seeing is, I now deal with a lot of people who have very high LDL cholesterol levels, or, what are considered to be high LDL cholesterol levels, and yet they have no evidence of heart disease.
Mm.
The other, sort of unique perspective that I get as a heart surgeon is, looking at the patients who end up on my operating table. And when you look at, all of the patients who end up needing heart surgery, it turns out that about half of them don't have elevated LDL cholesterol levels.
Mm.
Now, a lot of those people are on medication to lower their LDL cholesterol, but a lot of them aren't, and they have naturally low LDL cholesterol levels, yet they're still ending up on the operating table, because of their heart disease. So what it tells me is that, LDL may be part of the picture, but it's clearly not the whole picture. And I think the biggest sort of failing of the medical system around LDL cholesterol is that the vast majority of doctors stop at LDL cholesterol, and all they can do is look at the cholesterol panel, look at the one number, and somehow decide that you're at risk, you're not at risk, you need to lower your LDL cholesterol level, and they ignore all the other stuff about the metabolic health. They don't even look at the HDL and the triglyceride levels. And I think that that is a big failing of the medical system today, that we have become so narrowly focused on the LDL cholesterol.
Mm. What is your honest opinion on statins and the role that they play within Western medicine?
I think that they are greatly overused. I think that the data shows that the benefits of them are modest at best, and those benefits are within very specific, populations. And the pharmaceutical industry has done a great job of convincing the medical system that statins should essentially be in the water, and everyone needs to be on them, and everyone's LDL cholesterol level needs to be as low as possible. And again, I think that is a very narrowly focused messaging. And so do I sometimes recommend cholesterol lowering medications to my patients? Yes, I sometimes recommend it. But in the vast majority of cases, what I tell people is, let's fix your metabolic health first and foremost, and then we can kind of see where we're at from a cholesterol standpoint and whether or not it matters. Uh, in the end, my take on statins is that they are vastly overused. The side effects of them, especially with long-term usage, is underreported and underrecognized. And ultimately, what I come back to, similar to the way I look at high blood pressure and diabetes now, is that medications should not be the first line of treatment. We should
Mm.
be focused on what people are eating and what we can do from a dietary and lifestyle standpoint first, and then we can consider medications as a supplement to that if needed.
It sounds like you've embraced the idea of preventative medicine. How do we get all the other doctors on board with that? Because I feel like there's a little bit of a change happening, and you're probably at the forefront of it. So I'm curious to get your take on the evolution of this whole preventative idea.
Well, I think unfortunately, when you look at the medical system and the way it's, evolved to, we're not going to be able to start from the top down on this. We're not going to get the powers that be, the leaders of the healthcare system, to all of a sudden shift to preventative care. I think this needs to be a bottom up movement. I think it needs to come from the patients first. And that's why I love things like, what you guys are doing, getting this information in the hands of the people, so that the people can take control of their own health. The people can, work on making themselves healthy. And then I think they will then start to influence their doctors, because I hope that as more and more people are coming to their physicians and they're, reversing their diabetes and getting off their blood pressure medication, and they're losing all this, losing weight and getting metabolically healthy, that the doctors will start to wake up, to this. It always distresses me, and I hear the story over and over again. That whether it's someone that I'm working with, and then they go to their, back to their family doctor, or just someone, that I come across, and they say, I got off my diabetes medication, I got off my blood pressure medication, I lost all this weight, I'm in the best shape of my life, and I go and I see my doctor, and they have like no interest in what I did. They just kind of
Mhm.
nod their head, or they'll again focus on the LDL cholesterol, which maybe went up a little bit, and they'll say, oh well, that can't be healthy for you, despite the fact that they've improved all these other conditions. And unfortunately, I continue to hear that story more and more. But I am also encouraged because I go to the low carb medical meetings now, and I see more and more physicians from more and more specialties there. I see, younger physicians who are just coming out of their training. I see medical students. There's a medical student, Nick Norwitz, who's very active on social media, and he talks about this stuff, and he is educating his fellow students on it, and seeing things like that really encourages me as well. So I think there is hope, but I don't think that all of a sudden, the American Heart Association is going to come out and say, we got this all wrong, forget all that low fat stuff that we were talking about. I don't think that the U.S. Dietary Guideline Committee is going to flip the pyramid upside down like it should.
Mhm.
I think this really needs to be a grassroots movement, and patients and physicians together can partner to take back control of healthcare.
Mhm.
And it seems like there's some technology in the wings that are not used. Like I think telemedicine is definitely one of them. Maybe continuous glucose monitors are another one of them that are going to facilitate one single doctor like yourself being able to scale up to a lot more patients and help a lot more people. Do you see a lot of power in some of the technology that you're seeing and using?
Yeah, certainly, technology is going to help medicine to, continue to evolve. And again, it's doctors need to really know that that technology is out there. Honestly, the concept that you could use a continuous glucose monitor for a non-diabetic patient was foreign to me as well. It was something I needed to learn. I needed to have my eyes open to. Again, I have a brother who's a type 1 diabetic, so I knew what a continuous glucose monitor was, but it would have never occurred to me that I should be using that, to help prevent heart disease. But it
Mhm.
turns out it's a very powerful tool for doing that. Telemedicine, allows me to see patients across the United States, because unfortunately, there aren't doctors everywhere who are in tune with metabolic health. We have a growing network of them, and we have great resources that I can point patients to these days, like the Society of Metabolic Health Practitioners, that has, a database of physicians and other practitioners that are interested in this. But uh, you know, Telemedicine is a great tool because, as I said, I can be seeing patients from across the United States, and I can be helping them to improve their metabolic health.
Yeah, that's actually leads me to one of the questions that we had for you is, because obviously you had your own amazing transformation with the low carb carnivore approach and you lost a ton of weight. What was for you, what really had you make the shift from this weight loss transformation to actually going and opening your own telemedicine practice and preaching about, metabolic health and kind of changing the tune of how you were practicing ultimately?
Yeah, I'm just, once I, recognized how important metabolic health is and how it is at the root cause of heart disease, I just couldn't, that's not information that I can keep to myself. And
Mm-hmm.
ultimately, while I'm a heart surgeon primarily, my goal is to help people, improve their health by any means that are available to me. And so, I feel blessed every day as a heart surgeon that I can deliver that care to the people who need it at that time. But what I now recognize and what I tell the patients that I'm, that I'm doing heart surgery on, is that the surgery that I do doesn't fix the underlying problem.
Hmm.
And one of the things that always bothered me a little bit as a heart surgeon is that I knew that many, if not most, of the patients that I operate on still end up dying of their heart disease. Now
Hmm.
they die years later, and the surgery is able to give them quality of life back and extend their life in many cases. But it doesn't fix the problem. It
Hmm.
doesn't change what led to them getting blockages in their arteries and needing heart surgery in the first place. And
Right.
so, as I learned about metabolic health and realized that that does fix the underlying problem, I had to be able to incorporate this into my medical care. Uh, Unfortunately, again, because of the way the medical system is set up, um, as a heart surgeon, I don't get to see the patients until they need the heart surgery. So opening the metabolic health practice, the telemedicine practice, Ovadia Heart Health, has allowed me to connect with people before they get to that point and to help them prevent getting to that point. And that was also the point in writing the book. Stay off my operating table. It really is my mantra. It really is what I want to do. And people always come to me, my fellow physicians, or I'm on podcasts like this, and people always ask, but aren't you going to put yourself out of business? And that's what I say. I'm a lousy businessman, and that is exactly my goal. I want to put myself out of business. I truly, if it ends up that one day I have no more heart surgery to do, that would be a great success. The unfortunate reality is that heart disease remains the number one killer in the United States and worldwide, and it's number one by a wide margin. And so we have a lot of work to do on that front.
Hmm.
But I'm encouraged, and that's what I am out here trying to do every day now.
It's an incredible mission too, because it's like on one hand you're trying to put yourself out of business from a surgery perspective, but then it's led to this incredible new bit telemedicine practice where you're able to help advise people and really empower them to get their metabolic health back and live the best quality life possible. I'm sure you've had some amazing stories. I know one of the things that Doug Reynolds of Low Carb USA was telling us is he was blown away at how many spouses of low carb members were coming up to him and his wife during the conferences and thanking them just for the mood that their spouse was now in and just the way that it really impacted the quality of their life. So I'm sure that it's similar for you as well. And I'm sure that that's just an amazing feeling to have.
Yes, and even more important to me has become sort of the next generation. So I take care of the patients that I'm taking care of, but I'm really trying to take care of their children as well, because obviously as parents start to make these changes, the kids see it. I can tell you, my children, they look back at the pictures from 10 years ago, and they talk about, how big daddy used to be. But they understand, and I'm open in discussing this with them, it's because of what I was eating. And, I think, again, we look at the childhood obesity statistics in this country, and they're shocking. And unfortunately, they've only gotten worse. The recent COVID pandemic seemed to accelerate the increase in childhood obesity rates, um, and so the real issue is the 88% of adults that are not metabolically healthy.
Mm-hmm.
Um, we're seeing the children getting metabolically unhealthy earlier and earlier. And unfortunately, that leads to, very unfortunate stories like the one that I opened my book with of a 39-year-old woman, mother of young children who came in with a devastating cardiac condition that we could not save her from. And that is a failure of the medical system. I don't blame the patients for this. I blame the medical system for failing these patients, because
Mm.
every time, I have a 40-year-old on my table for heart surgery, that is a failure of the medical system. And we as the medical system, we as physicians need to start taking responsibility and need to wake up to this and say, what are we doing? How are we at this point that, the vast majority of people are unhealthy?
Mm.
It's funny you say that, because I think one of the things we talk about too is kind of the interrelationship between the food system and the healthcare system, and how they really need to be thought of as one. And there's just such a interesting phenomenon happening that's been happening for decades, where we're creating more products than actual food. And there's been a paradigm shift around food. Like, we don't think of food as medicine anymore. We grab the easiest and most convenient thing for us to eat, and we eat it, and we don't think much about it. And I think everyone's experienced it at some point in their life. But I do think that, like, there is this narrative that has been built up that we've kind of detached from the food system being this important factor of the healthcare system.
Yes, definitely so. And there are many different aspects of that. Ultimately, what I come back to is this empowerment,
Hmm.
and putting putting the power back in the hands of the patients, to help themselves, and realizing the power that goes along with that. And
Hmm.
I talk about in the book, how I don't have the Dr. Ovadia 28-day diet plan.
Mm.
I talk about what worked for me, but I don't think that that is necessarily the right answer for everyone.
Mm.
But the first step in all this is realizing that the food that you are putting in your mouth is the primary determinant of your health, and becoming more intentional about the food that you put in your mouth. Um, and what I find, happens with people is, when I present them with the honest choice that they have, and I wish that more physicians would frame it like this. So, a patient that comes with diabetes or high blood pressure, yes, you can take medication. But the unfortunate reality that we know is that you're going to end up on more and more medications, and that the medications aren't really going to fix the condition. They're just trying to prevent, or really, delay the complications that come from those conditions. And when you present the option to a patient that you can start taking this medication, you are going to need more and more medication throughout your life, and ultimately you're going to get complications that are going to shorten and lower the quality of your life. Or you can change the food that you eat. Every patient says, I will change what I'm eating. But unfortunately, that's not how it gets framed to patients. And most doctors, when you show up with diabetes, they just say, start taking this medication, oftentimes with minimal, if any, explanation. And they're not even, they don't even talk about the options of changing the food that you eat.
Mm.
And again, most doctors' advice around the foods that we eat, we know are not working.
Mhm.
So, it ends up just being a horrible, feedback loop where, doctors say, well, the patients don't follow the advice, or the advice doesn't work around the types of food that they eat, and they still, it doesn't do anything. And the reality is that we've been giving people lousy advice about what to eat now for a long time. And yes, that advice doesn't work very well. The low fat diet and counting your calories. We know that this doesn't work. And yet we continue to give the same advice, and we see patients getting sicker and sicker. And, it kind of amazes me that more doctors don't stop and think about what they're doing. But I understand it, because you're trapped in the system.
Hmm.
And honestly, until I had my eyes open because of my personal problems, I didn't recognize it either. So I don't really blame the physicians. I blame the whole system. And the physicians are entrapped within that system. And like I said, ultimately, we need to be waking up, the patients, and ultimately waking up the physicians. And then I hope that grassroots movement will then ultimately change the system.
Mhm. Yeah, that you definitely feel when I was reading your book, one of the core tenets to what you were talking about is that it's your responsibility to take control of your health. And that was something that we wanted to ask you, because in Western medicine, it seems like there's this kind of like blanket assumption of you just have to listen to what your doctor tells you. And if they tell you to get on this type of drug or this type of medication, you're just supposed to do it. How do you think, as things are changing, patients should think about taking in inputs from their doctors moving forward?
Well, again, I think you really need to be questioning, is the advice that my physician is giving me helping me or not?
Mm-hmm.
And if you're going to the doctor year after year and they're putting you on more and more medicines and you're not feeling better, you don't have the energy that you want to get through your day, and, whatever the issue might be, your diabetes is getting worse, or your high blood pressure is getting worse, or simply you feel lousy all the time, you have to start questioning their advice. And it amazes me that people put a lot more effort into picking their accountants and their car mechanics and all of these other people who play a role in your life, and yet when it comes to a physician, most patients just take the physician that's assigned to them by their insurance company, or whoever happens to be located closest to them, and they don't do the research. And again, they don't have that feedback, because if you kept going to your mechanic and your car kept breaking down, you would find a new mechanic.
Mm-hmm.
And if you're trying to run your business and you're ending up broke, you're going to question what your accountant was doing for you. And yet we just seem to accept, we get more and more unhealthy as we age, and we've come to accept that that's a normal process, and it's not. There is no reason why we need to be you know unhealthy as we get older. And so that is sort of the central tenet that people need to start focusing on and need to start questioning. And if their doctor isn't helping them to get more healthy, then it might be time to look for a new doctor.
Mm.
I think maybe this is a perfect way to tie this back to your story at the beginning. So you lost 100 pounds in your 20, 30 years into your career. What sort of benefits did you see on the other side of that in terms of energy level, lifestyle, you name it? What sort of things did you see? Because I think that a lot of people will be inspired by that to say, hey, I'm working this hard job. I really don't have the time to be focusing on, what I'm eating, or, whatever it is. Everyone has an excuse, but, I think your story has a ton of inspiration packed in there. So what were some of the benefits that you saw?
Yeah, so what I try and tell people now, when they say, "Oh, it's so hard to get healthy," one of the things I tell them is it is so hard being unhealthy, and the energy level and the mental clarity are probably the two biggest benefits that I saw as I got healthy. You know, I obviously would work, and still do work long hours. Some of the surgeries that I end up doing are, end up being pretty long, 4, 6 hours even. And I was struggling a little bit to get through that. I realize in retrospect, and again, it's one of those things where you just kind of think that's how it is, so you don't necessarily pay attention to it. But now when I look back, I realized that I was not serving my patients well,
Mm.
because I would need the multiple cups of coffee to get through my day, or there were times that I would be in my office in the afternoon after a long surgery, basically taking a nap, trying to get my computer work done and stuff. And now, I really have endless energy, and I can do back to back long surgeries without a problem. I have mental clarity that comes with it. I feel like I am much better focused. I could put efforts into all the other things that I'm doing, like writing the book and the telemedicine practice, and my I can interact well with my kids. I can play with them. I can, I have the energy to keep up with them. So those benefits are ultimately what's most important and what people recognize. Realize that for the most part, people don't feel their blood work.
Mhm.
Those are things that, the doctors are interested in. But oftentimes, people don't necessarily feel a difference in their blood work. It's just that you have the energy, you have the mental clarity, you have the enjoyment of life ultimately, that is so important. And that is also why I think people can stick with it, because when you give them advice that actually works and they see these benefits, you know, that, you know, the reason that I don't go back to eating the way I used to eat is because I know how it makes me feel, and I
Mhm.
don't want to feel like that. So it's not about eliminating certain foods or not. It's about I want to feel my best every day, and these are the habits that keep me feeling my best every day, and that is the sustainable change that people ultimately need to come to.
It sounds like you've done an amazing job of anchoring yourself to the incredible benefits that you've gotten through this lifestyle. And you're able to go back to maybe when you were 100 pounds heavier and how that felt. And I think what you just mentioned, it's really a priceless investment, right? The ability to have unlimited energy in your job. And even more importantly, to have energy to play with your kids, which is essentially making you a better parent and a better father. Because we hear this all the time, and our people direct message us and say, oh, the a carnivore diet or a low carb diet is expensive. I don't have money to pay for ribeyes. And we think about it as number one, it's really not more expensive because you're avoiding all the processed crap on the inner aisle of the grocery store. So you really
Yeah.
are paying less. And number two, it's like, I think all three of us will agree. I'll gladly pay a few dollars extra per meal for the most nutrient dense food that's nourishing my body, that's going to make me feel amazing and help me be a better boyfriend, better friend, better businessman. So I think you just touched on all that beautifully.
Yeah, we need people to start recognizing, sort of the holistic cost of their food. And it's not just, the amount of money you're paying at the time that you're purchasing that food. It's, what is this costing me in terms of future health problems, in terms of current, life quality, and that really is the question that people need to be asking, and that will lead you to the same conclusions that I think we have come to. That paying a little bit extra for the whole real food is very much worth it in the end. And again, the reality is that we end up probably not paying all that much because you need less amount of food, you eat less often, when you're eating nutrient dense whole real food. And so in the end, I'm not even sure that it ends up costing any more in the short term, um, but it certainly ends up costing less in the long term.
Mm-hmm.
Absolutely. Dr. Phil, this has been amazing. I think we've covered a lot of ground here and really gotten your story out there, which I think is an incredible one, but also touched a lot on your principles that have helped you get to where you got to. So it's hugely important information to get out there, and we're just really happy to have come across you and gotten connected with you. How can other people get in touch with you? Social media, and is that kind of the best route?
Yeah, so the website ovadiahearthealth.com, OVADIA hearthealth.com, it has all the information about the practice and signing up, working with me as a patient. On social media, I'm most active over there on Twitter with you guys, and I'm at iFixHearts on Twitter. The book is called Stay Off My Operating Table. It's widely available at all of the usual places. And I love interacting with people. I love hearing their stories. We'll have to try and get together some more for some of the Twitter Spaces and stuff as I can squeeze that into my days. But reach out to me. I'm very accessible. I answer questions on Twitter whenever possible, and I would love to meet more and more people out there.
Perfect.
Absolutely. Dr. Phil, thanks for fighting the good fight for us. We appreciate it. You're doing a ton of great work.
And thank you guys for all the great work you're doing to get this information, into the hands of the people who need to hear it.
Perfect. Thank you, Dr. Phil.
Thank you.